I see. I was just looking for her.
Dr. Jonathan Tripp is looking through his computer list today. He's one of the few guests that comes into the studio and brings his own laptop with him.
That,
Um,
that's
you,
called the peripheral brain.
yeah, you carry it with you everywhere you go, right?
Pretty much. I let the nurses carry it in the office, and then I go back and work on it. But you're right; it comes home with me and comes here with me, so it's with me a lot.
Yeah, I made the mistake of when I bought a new computer because I was thinking I was going to be doing a lot of work from home. Somebody said, well, it'll be better for you to get a desktop unit, but so few of those are sold any longer. Hey, we've got a topic today with the doctor. Better Health with Tripp Family Medicine here on News Radio 1310 KLIX and newsradio1310.com. And of course, Bill Colley answering some telephone calls if they come in. But we were having a discussion off air about concussions, and that's the topic today. And we were talking about athletes, especially that's where I think people think about it most. But of course, you can get a concussion any number of places, not just necessarily when you're out playing ball.
Yeah, I have a lot of the reason why this topic came up is it just seems like I'm seeing a lot of concussions in our clinic, and I hear about them in athletics and other places. But they range anything that you can have your head shaken or hit can cause a concussion. And the problem is most people think of a concussion as, when you're knocked out. Did you lose consciousness? And the answer is that is guaranteed because if you got knocked out, your brain was hit hard enough to kind of reboot the program, and you're down on the ground, waking up. But most concussions don't knock us out. We're not really loss of consciousness, and some examples are car accidents, definitely sports related things, just simple falls. I tripped over something that was at the end of my bed at night. Instead of hurting my toe, I went down and hit my head on the dresser, and that absolutely concussion. Um, and a lot of the symptoms are kind of subtle. Well, a headache, and you think, well, of course you hit your head, but these headaches will last sometimes weeks and even months on a daily basis, depending on the severity of the concussion. But a little bit of nausea, a little bit of loss of balance, just kind of subtle features. But then we get into more serious stuff like we have memory loss, disorientation, kind of, and I've had some very severe concussions that we've worked through over the last couple of months. I have a young lady that had a traumatic jet skiing accident that completely, knocked her out, hurt her body in various ways. But since June, she's been moving forward with, trying to get her memory back and literally lived on a notebook every day to be able to look back and see what happened the day before. In fact, there's a movie called 50 First Dates
I've seen that.
that, is just, it seems comical, but it's tragic. And this is exactly how this young lady's been living. And then she's steadily progressed. And I don't know that she's using the notebook anymore, and she's remembering things from the past and the things that have happened since the accident. So typically, if somebody loses memory, they're usually losing their memory from the time of the accident forward and struggling with, what did I do today? What did I do yesterday? And that's typical. But I have a scenario right now with a young man that's got both. He has had trouble remembering what's happened since the accident and believes he's still living in 2012. So, he's a 14-year-old that is 11 in his own mind and lives in Layton, Utah instead of Twin Falls. But he's got these friends that slowly he's remembering their names and who they are and that they've played football together and can't figure out why they live in Twin Falls if they all when he lives in Layton. So some of those things are pretty tragic, and but the emphasis on today is to talk about what is involved in a concussion, how you get them, where the dangerous positions are, to play, because a lot of it's sports related, or riding a bike without a helmet, or a skateboard without a helmet. Things we can do to protect against these, because you go from a perfectly healthy, often child, to someone who is nearly an invalid, at least temporarily. And it disrupts school, it disrupts everything in life, and can become what's called a permanent, traumatic brain injury.
We've seen a redesign in like football helmets, for instance. When I look at them, they don't look anything like they looked just 10 years ago, and especially not like 40 years ago when I was playing. They have a almost like an upper shell and then a lower shell in the back, and then I guess that's all designed. Science is trying to come up with a better way to protect the head inside that.
That's exactly right. Because, and when you go back 50 or 100 years, they either didn't wear anything or they had kind of a leather head helmet that had a little bit of padding to it, no face guard. Now we have significant face guards. We have interior padding that is very focused on trying to keep the the head in a cushioned position, knowing that it'll get hit in football. But yeah, we are constantly looking for better ways. What's interesting is a lot of people say, football is the only place you get a head injury, or they'll think of another sport that they've seen somebody like basketball and say, "Oh, that's the worst," or "Soccer's the worst," or. And what's interesting to me is to find out, what is the worst sport. So let me tell you a couple of those. But before we even get there, I want to invite callers with experiences or questions relating to um, concussions and how things have gone, because sometimes the recovery is very quick, other times it's very slow. And I'd love to hear some of those examples because
Mm-hmm.
nobody's the same. No two concussions are the same.
And we'll get to those after the break. I've got about 30 seconds before that.
Okay, the sports that are most likely to cause get a concussion in. Everybody predicts football, and for young men, I think that is the truth. Here we go. I'm going to read them off to you. Highest rates of concussion for boys, and this is according to the Children's Hospital of Philadelphia. For boys are football, ice hockey, and lacrosse. And of course, I grew up in the Philadelphia area, and lacrosse is big there, not so much here. But lacrosse is sticks and running and smacking people. For girls, it's soccer, lacrosse, and basketball.
There you go. Because basketball, sometimes you fall on that court.
Or yeah, soccer, you might be trying to hit a ball with your head while somebody else is trying to hit your head with their head. Yeah.
Yes, we have more coming up with Dr. Jonathan Tripp in just a few minutes. You mentioned hockey in the Philadelphia area. That's part of the unholy trinity.
Yes.
Uh,
Yes, it is.
Dr. Jonathan Tripp joining us in studio this morning. We call it Better Health with Tripp Family Medicine. It's 8:43. Bill Colley answering the telephones. And the telephone number, if you'd like to reach the program, 736-0300. 35 right now at our studios, at least outside. Inside, a little bit warmer. And Doctor, we have a caller who's been patiently waiting on hold.
All right, let's do that.
You're on the air with Dr. Tripp.
Oh, hi there. So, in February of 2014, I was crossing the parking lot of a health club, and I slipped and fell on the ice and hit the back of my head. And I can't remember if I hit my head first and then my tailbone, or if it was my tailbone and then my head, because I just kind of slapped, the pavement, and there was ice there, and I didn't know it was there, and I slipped and fell backwards, and I never lost consciousness, and I never really lost memory or anything, but honestly, I just don't feel like I've been the same since, and I can't, I get headaches, but not all the time. I just feel like my personality is kind of weird. I don't know. Is that something that's possible?
Absolutely. Head injuries, whether they're an accidental fall or, from getting into a, altercation and somebody beat you up, or a car accident, frequently people will have chronic feelings of kind of a fogginess in their thinking, almost a slowed mentality of intellectual mentality, but especially the hard ones to figure out are what you say kind of a personality change. And the personality change can be for a lot of reasons. It can be you all of a sudden became very aware of your vulnerability, where you're coming out of probably a health club doing good things with your physical body, and then all of a sudden, one slip and everything changes. But it also this is going to sound a little on the alternative medicine side. In my training as an osteopathic physician, there's a group that does what's called cranial manipulation, which is really very soft touch around the head as well as for the sacrum. So it's called cranial sacral manipulation. So it's funny you said your head and your tailbone, but I do some of that, and there's others that are more expert at that. And I have seen in my own training a doctor work on a guy who'd been bludgeoned with a pipe, and had a personality change, dramatic personality change, actually recover after about a 3 month effort of treatment of this cranial sacral manipulation. And I know others would argue and say, well, he just needed the 3 months to recover, but it was a pretty dramatic before and after when the treatments actually seemed to take place. So there is a little hope that I have for you there. I can't say I'm your absolute expert, but be happy to see you and kind of discuss that. But yes, is the answer to your question. That can be directly
Well,
from your fall.
I appreciate that because my symptoms didn't really show up till about 3 months after my fall, and I started to struggle with words, and I couldn't remember what I was doing, and I just would forget a lot of things as far as processes and everyday routine kind of things. But I mean, that's improved, and I have had some sacral cranial work done, and the lady said that I hurt my, like my intestines and my esophagus. The biggest injury, of course, was my neck. The whiplash from the neck was the worst part of it, because I'd had other injuries, and boy, that just frosted the cake for me. And so, that it's good to know because there aren't very many people in the area that do the sacral cranial work, and I think I really need to have more done because I just don't feel like I just don't feel right.
Sure. Yeah, and I wouldn't want to make a promise that we can cure it all, especially, you've been doing this for over a year, but I'd give you a little hope to say it's worth a try. And, let me give you or give our audience our contact information. Our phone number at our office, this is Tripp Family Medicine. It's area code 208-933-4400. You can also reach us on the web at trippfamilymedicine.com and on Facebook at Tripp Family Medicine. But the phone number is 933-4400. Thank you.
Want to thank you for the call. We have another caller with us, and you're on the air with Dr. Jonathan Tripp. Good morning.
Hello?
Sure, you're on the air.
Go ahead.
Okay.
Do you have a question for the doctor?
Actually, I am calling in because my son is a patient of Dr. Tripp's currently. I'm sorry, I'm listening to on the radio and me talking, and it was confusing me. But my son just recently fell a week ago on Monday, and he's been seeing Dr. Tripp. He was at school and was playing indoor soccer on the gym, and he had the ball, and there was another boy who came to try and steal the ball from him, and they got caught up in the ankles, and he fell and hit his head on the hard surface of the gym floor. And it has been very eye-opening to see just how concussions not only affect him, but affect other people all around him. He wasn't able to stand up and carry his weight. He's had tremors where his whole body will just shake. We took him to Tripp Family Medicine first, and then we took him over to the emergency room where they did a CAT scan, admitted him into the hospital, and he was there for 2 nights, and then they did an MRI as well, and they didn't find any bleeds or anything like that, so that's good news. But Dr. Tripp has gone above and beyond by doing the cranial manipulation on him, and we have seen major improvements in just a week and a few days. His speech, he used to stutter quite a bit, and now he's getting better at that. He's gaining a lot more muscle strength back, a lot more muscle control. We still have a long ways to go as far as him getting back into school and whatnot, but he has made a ton of progress, and we're just happy that we have found somebody who has the experience and has the know-how to help treat him. So, yeah.
Well, yeah, I appreciate that phone call. In fact, this is the young man I was talking about who thinks he's 11 when he's really 14. And it's been dramatic because he couldn't even identify his parents when he first had the concussion. And that took about 36 hours before he knew who mom was and who dad was. So this is a dramatic, relatively small impact injury has had a dramatic effect on this young man. And so, his memory is returning in some ways, like he'll remember things since the accident. He'll remember ads. He remembers conversations. But there's a lot of things he doesn't remember, and there's this blank part of time between 2012 and now that he doesn't recall at all. And he knows he's got people telling him, no, it's 2015. So it's not like he forgets that somebody's told him that, but he's still very dead set on, you know, where he lives and what he can tell you all kinds of details about the Super Bowl in 2012. It's amazing. Even who was ahead at the halftime and that his aunt was saying that she was gonna, cheer for the group that was ahead at halftime, and I wouldn't even hardly know who played in 2012. So he's got very specific details about 2012, and so that's been a great experience. I appreciate the vote of confidence, from the caller, and yet very first and foremost was reaching out to concussion experts through in the Boise area as well as University of Utah and Primary Children's Hospital. So I want to make it clear that when I do treat somebody, I don't try to be the expert of all things, but I am looking for those that can assist that do know more than I do so that we don't let things go too long on any kind of injury, and that, in particular for this young man.
Want to thank her for the call, and obviously the news is that things are improving now and improving dramatically, and people can regain what they've lost. Obviously, sometimes it just takes a little while.
Yeah, most of the time people recover fully from concussions. The biggest challenge is to say how long. Like this young man, a week from now, he may be 100% back in school, or he may be at 50% of his mental capacity, and we might take months doing this. I have another young lady who's had 2 car accidents, end of December 2014, and then again about April. And she's functioning well, but she feels very distracted, very poor attention to details, where in the past she almost has OCD type tendencies about details, and trouble with sleep. And so the first caller, one of the biggest things I would start by saying is, let's reestablish good sleep hygiene. Going to bed the same time, getting up the same time, get your brain reestablished, because that's a big factor in mentation, or your ability to think and remember and recall, so that you feel sharp. So those are some beginning points.
We have some callers looking to join us still, and of course, number is 736-0300. I believe we have a caller with us right now. You're on the air at 8:53 with Dr. Jonathan Tripp.
Hi.
Hi, good morning.
Throughout my life, I've had multiple hits to my head and stuff, and my brain has been kind of fuzzy and stuff has gone fuzzy and stuff. Would you call that a mild concussion, or is it just getting my head hit?
There are full concussions and what some doctors are talking about, subconcussive hits. And what we're trying to understand is if these all add up to worse brain injury over time. And if that turns out to be true, then you have a lot of decisions to make about, is it worth my child participating in a sport or an activity that I know concussion is likely? Let me give you a good example. Snowboarding. Snowboarding has become more popular for, the teenage group than the old time skiing. But snowboarding, by its leverage of how the feet are attached to the board, when you fall, you tend to fall with a slam to the head, either forward or backwards. And yes, you can hurt your legs, your knees, your ankles. But, that's when, the idea is, as long as you can keep standing, keep snowboarding. And that's long-term damage. And so I'm not saying anybody should stop snowboarding. I just say this is more information about what to be careful with. So the answer to your question is if you're feeling foggy, thinking, fuzzy-headed, any of that, that's time to see a doctor and say, what can we do to improve your circumstances? And sometimes there's nothing to do other than time. It's rest, and time is some of the biggest things that we do with concussion. But there are specifically cognitive therapies with like a therapist that will help you through mental stuff, physical therapy if we have any physical issues, and then speech therapy, because a lot of people have difficulty with their speech following a concussion.
Want to thank our caller for chiming in, and we've got a couple of minutes to go here. We were talking off air about a couple of instances where back in school and football practice or in games they would say they'd call it having your bell rung, and it was considered to be somewhat funny. And then in the old cartoons, someone would get a concussion and they would see either stars or birds floating around their heads.
Yeah, we have those are fun to see or fun, old memories. What's really nice is recognition of concussion has come a long ways in the last several years, not even 10, the last 3 years. And so more is being recognized. Kids are being pulled from play. People are recognizing that, you know what, I can't just jump back into my college classes and be the same. And the academic administrators are starting to recognize we need to back off or give time off and try to help these people recover. And another example is we see movies where the person I just went and saw the latest James Bond movie, and he gets hit in the head and crashes against stuff all the time throughout the movie, and kind of shakes his head, and then about a minute later, he's ready to go at a full fight, and that's not reality.
Jim Rockford got pistol whipped every week on the old Rockford
Rockford
Files.
Files. Oh my
Yeah.
goodness, I haven't heard that name in forever. But yes, so what we see in the movies is movies. It's not reality. And so recognizing that when a kid gets hit or an adult or there's a fall in the parking lot, that may take some substantial recovery time. But everybody's individual. Once you get through your symptoms, if you're a week free of your symptoms, a week after you've had a concussion, I would give it about another week in between and then say, you know what, if it's that quick a recovery, you're probably okay. But if you have more severe symptoms, they last longer, don't go back to play because your risk is a more terrible situation called second hit syndrome, which can threaten your life or at least your mental capacity for the rest of your life.
We're going to end up, and I apologize, leaving some folks on the line who we're trying to get through today. But you know what? If they'd like to get more details, they could probably call you at the office.
Absolutely. That's 933-4400. And I just want to say I have two new practitioners. So there's a total of 4 of us now working at the office. We have awesome healthcare providers, and we'd welcome you to come to the office. That's 933-4400.
And you'll be back, or somebody from the office will be back next week, next Wednesday morning.
We'll have a hot topic then, too.
All right. Hey,
Thanks.
I want to thank Dr. Jonathan Tripp, of course, for joining us on Better Health with Tripp Family Medicine, right here on News Radio 1310 KLIX and newsradio1310.com. Coming up following the news at 9 o'clock, Lieutenant Colonel Steve Heil, retired from the U.S. Air Force, joining us for a discussion on Veterans Day and veterans issues this morning, right here on Top Story with Bill Colley.